say in the matter as well.
Being delivered to South Africans, the performance profile of providers so that a pay-for-performance measure can be implemented, monitoring the impact of the fund in addressing healthcare needs, liaising and exchanging with information with various government entities, maintaining a national database of demographic and epidemiological data for the purposes of planning and service delivery, performing functions in a cost-effective and efficient manner, and funding should be aligned to the health policies that are approved by the Minister, and the fund has an overall responsibility to protect, promote, improve, and maintain the health of the entire population. The fund has powers to employ staff to purchase equipment and buildings and the like. It will be able to insure itself against loss, damage, and liability. In the case of legal proceedings, it has the right to defend itself. The fund will also be able to should be able to negotiate the lowest possible price for services as well as goods, and perform research relating to universal health coverage to improve access to care for all South Africans. The board, which is the governing structure of the fund, will be established, and this board will be accountable to the Minister of Health. The board will be made up of 11 members, and they have a range of expertise relevant to running such a fund. They would have a 5-year term, which is renewable once. There are clear conflicts of interest included in the bill, where members would not be eligible for positions on a board. The Minister will appoint an ad hoc panel, which would call for nominations to serve on the board. There will be public interviews of the board members, and the ad hoc panel will then make recommendations to the Minister on appropriate persons to potentially serve on the board. The Minister may remove persons from the board where he or she is performing inappropriately, or the entire board if the case requires. The Minister also appoints the chairperson, while the board will elect from amongst its members a deputy. In terms of the functions and powers of the board is the accounting authority in terms of the Public Finance Management Act. It should require to meet at least 4 times a year. It will advise the Minister on various matters relating to the fund, such as financing, administration, pricing, amongst others. The fund must conduct and disclose itself in terms of the interests that the members of the fund have, and any paid employment and conflicts that may arise. The board will also determine its procedures. The remuneration rates and reimbursements of these members will be determined by the Minister of Health in consultation with the Minister of Finance. The fund has to also have a CEO, and this CEO must be technically competent and have the appropriate experience. The board will interview these candidates and make recommendations to the Minister on who would be an appropriate CEO. The CEO has a 5-year term, renewable once, and the board may recommend the removal of the CEO where he or she is not performing appropriately. The CEO basically runs the organization and will account to the board and perform all functions that the board assigns to him or her, and should run an efficient administration, including areas such as human resources and investigative unit, dealing with issues of fraud and corruption where they may arise. The fund should have specific units, including planning, benefits, provider payments, and accreditation, purchasing, contracting, payment administration, performance monitoring, as well as risk and fraud units. The CEO must prepare an annual report which will be presented to the Minister and Parliament, and the CEO should also be meeting with the Minister, the DG, and the Office of Health Standards Compliance at least 4 times a year in order to discuss matters relating to the fund. The board, in addition, may establish committees, governance committees, that it sees fit in order to run an efficient organization. Additionally, the board has the flexibility of establishing technical committees where it considers this appropriate for the efficient running of the fund. All of these committees are subject to the standard governance provisions that are in the bill. In addition to the board itself, the Minister will appoint 3 advisory committees. From the comments that we received, there was much concern that the Benefits Advisory Committee and the Pricing Committee particularly may exert a significant influence over the way the fund operates. So these committees will report to the Minister, And the Benefits Committee, for example, will design the benefits of the National Health Insurance Fund, consider what are appropriate treatments, and make recommendations to the Minister, who will then advise the fund as to what the benefits should be relating to that. The Pricing Committee similarly must investigate the costs of delivering services, must investigate that, negotiate with the relevant suppliers, and make recommendations to the Minister on that. Each of these committees have the appropriate expertise in order for them to be able to deliver on these functions. There will also be a Stakeholder Advisory Committee, so that various stakeholders, from professional associations to labor to civil society and advocacy groups, would be able to engage with the Minister directly on the performance of the fund through the Stakeholder Committee and make recommendations on how the fund could improve its performance. All of these committees would have to disclose their interests and perform in the manner of all of the governance provisions I previously mentioned. In terms of Section 8, which deals with general provisions that are applicable to the fund, this section highlights the role of the Minister, which is governance and stewardship of the national health system, including the National Health Insurance Fund, the role of the department as well in terms of guidelines, norms and standards, the human resource planning, development, production and management, coordinating health services, planning and development of public and private health establishments, the integration of annual health plans, and then subject to Section 57, the Minister will introduce amendments to the National Health Act to delegate certain functions back to provinces, because you will see later in the presentation where we're making amendments to the way provincial powers are managed. We'll also designate categories of hospitals as autonomous legal units and establish the District Health Management Office as a government component. In terms of the role of medical schemes will remain as they are now, as voluntary organizations. Once the NHI is fully implemented, the Minister will introduce regulations that would limit the benefits to medical schemes to those services not reimbursable by the fund. In other words, what we call complementary cover. The District Health Management Office, which is a new structure, is a national government component that is responsible for managing, facilitating, supporting, and coordinating the provision of primary health care services for both personal and non-personal care at a district level, at a local district level. The CUP, or what's referred to as the Contracting Unit for Primary Health Care, which is a second new structure, is the preferred organization by which all of the providers of healthcare in a district will contract with the fund. This organizational unit will include district hospitals, clinics, CHCs, ward-based outreach teams, private providers within that specific area. This organization is responsible for understanding the burden of disease, accrediting both your public and private providers, getting involved in contract management, ensuring that the referral systems are working effectively, and integrating the health system at a local level between public and private providers and where the services function. Then there is the additional structure of what we call the Office of Health Products Procurement. This office is responsible for setting up the procurement structure for all goods in the health system. That includes medicines, equipment, consumables, and the like. This office will be responsible for the selection, the procurement process, price negotiations, and contract management. It will support the Benefits Advisory Committee to develop an essential medicines list, an essential equipment list, amongst others, which will be part of the benefits. So the formulary that will be derived from the benefits list will be a recommendation from this committee. They will also look at new medicines and the evidence of treatment options and prices where those may be appropriate from time to time. Service providers that are delivering a service to the National Health Insurance must first be certified by the Office of Health Standards Compliance. Thereafter, the fund will accredit these service providers. The accreditation process looks at what are the minimum range of services that provider will be able to provide. Do they have an appropriate mix of the health professionals to deliver the service? The treatment protocols and referral pathways, and whether the provider will be able to adhere to that. The provider must provide information relating to the procedures that were delivered, the length of stay, if that's appropriate, referrals, and any other information the fund may be interested in understanding. It must adhere to the pricing regimen. It must also conclude a legally binding contract with the fund itself. There will be a renewal of this accreditation, which will be on a 5-year basis. If a provider is refused accreditation for some other reason, he or she may then be able to appeal to the fund, and there is a defined appeals process for that. There is an information platform for the National Health Insurance Fund to operate effectively and efficiently, and this platform must assist the fund to appropriately plan to deliver health services, monitor its budget, and adhere to guidelines. The personal information that is available within the health information platform remains personal information and confidential and will not be released by the fund. In terms of payment of providers, there are various payment methodologies. For primary care providers, they will be contracted and remunerated via the CUPs I spoke about earlier through a capitation system. Specialists and hospitals through performance-based remuneration and DRGs. EMS services, emergency medical services that is, will receive a capped case-based fee. The minister will from time to time make regulations relating to the payment mechanisms that would exist. Coming to section 9, which is complaints and appeals. Here the users of the fund may lodge complaints about the type of service they receive. These complaints must be lodged in writing, and the fund has an obligation to respond. Should an individual not be happy with the response of the fund, he or she may then lodge an appeal with the appeals tribunal, which has been established. It will be 5 persons appointed by the minister, and this tribunal has the powers of similar to that of a high court, and the intention here is to be able to resolve these matters in a speedy manner without the high costs that may be incurred in terms of going through the usual legal process. Going on to section 10, which is financial matters. The bill goes to explain what are the sources of funding. Here the main source of funding is appropriations, which is from Parliament into the fund. And the chief sources of income for the appropriations are general tax revenue, funds that may be shifted from the provincial equitable share and conditional grants into the fund, a reduction in the medical scheme tax credits over time, the possible consideration of a payroll tax, as well as a surcharge on personal income tax, which the National Treasury will announce from time to time. The fund must be audited, and the Auditor General of South Africa is required to perform audits over the fund. The fund must produce annual reports about its financial performance as well as its performance in delivering services. These must be submitted to Parliament and the Minister, and the finances will be audited as are indicated by the AG. In terms of the section 11, which is a miscellaneous section, it deals with the duties and powers of the fund. It provides for protection of confidential information of individuals, deals with offences and penalties where this may occur relating to the fund. There's provisions relating to regulations that the fund may make. There are also provisions for directives. The NHI is intended to be implemented over a 7-year period from now. It planned to be fully implemented by 2026 through a phased implementation approach, and the bill identifies the 2 phases, which we are now in phase 2, and then there is a phase 3 thereafter. Phase 2 ends in 2022 and phase 3 commences in 2023 to 2026, and the bill identifies the various steps that the fund must be taken before the NHI is fully implemented in its entirety. In order for all of this to happen, there is also a need for us to make amendments to various pieces of legislation, and the legislation includes 12 pieces of legislation, such as the Medicines and Related Substances Act, the Occupational Diseases, Mines and Works Act, the Health Professions Act, the Dental Technicians Act, Allied Health Professions Act, the Medical Schemes Act, Mental Health Care Act, the National Health Act, the Nursing Act, the Traditional Health Practitioners Act as well, and there may be other relevant pieces of legislation that we have not identified. It's important to also highlight the role of provinces under NHI. So the Department of Health will delegate to provinces as management agents for the purpose of provision of healthcare services. And in those cases, the fund will contract with those sections within the province, such as provincial hospitals or tertiary, regional, etc. The provinces will also be responsible for managing ambulance services. They will assist with the District Health Management Office in controlling the quality of healthcare services and facilities. They will also delegate provincial and regional hospitals and provide specialized services here. They will participate in the interprovincial and intersectoral coordination, collaboration of healthcare services, provide technical and logistical support to the district health councils, coordinate health and medical services during provincial disasters. They will provide pathology, forensic, clinical medicine, and related services, provide and maintain equipment, vehicles, and healthcare facilities, which would belong to them, consult with communities relating to healthcare matters, and overall promote health and healthy lifestyles, provide environmental pollution control services, and ensure there is health systems research and programs and public health sector services are functioning well. That is the end of my presentation. Thank you, Minister.
Thank you very much, Dr. Pillay. I wonder if I could just get some help. I'd like the Friends of NHI logo up again, but I'm not technologically. I just like it up again.
Okay.
Thanks.
Yeah.
Thank you. Thank you so much. About 3 weeks ago, I was very fortunate to attend the BHF conference, and I see Zola's here. Where is she? There you are. Amazing lady. Amazing conference. I think just about everybody who is on this logo was there. And as everybody will see, these organizations, this cohort of organizations, comes from a very, very broad spectrum of our socio-economic topography. And I'm sure this must have been a difficult conversation to begin, but here we are with one voice saying one country, one healthcare system, universal healthcare for all. And so I would like to invite the organizations to come forward and give their statements in regard to NHI, in support of NHI. And I'll first ask from COSATU, Mr. Gwena Manamela, to come up, please. Thank you.
Good morning. Minister, Deputy Minister, delegation from the Presidency, partners and stakeholders, good morning once more. COSATU welcomes the release of the long-awaited NHI Bill. The National Health Insurance remains the best vehicle to usher in universal health coverage. COSATU is happy so far about the progress made, although time has actually moved in terms of NHI implementation. We hope that the departments will prioritize its implementation and cover the lost ground. More healthcare users will now enjoy access, and we expect department to improve and increase human resources, both quantitatively and qualitatively. Improve security so that access is not only limited to 8 to 12 hours, but 24 hours a day, 365 days per annum. The South African health system is in urgent need of an overhaul in terms of its financing arrangement, management, and the ability to deliver quality healthcare services There is general consensus that the health system is dysfunctional and that the quality of the health services is poor. Access to quality health services often depends on one's geographic location, race, employment status, income level, gender, and where the healthcare services are delivered, public or private health sector. The inequality in the financing and provision of health services between public and private sectors, as well as provincial and district variation, has detrimental impact in terms of the well-being of the population. COSATU, together with like-minded organizations, have on an ongoing basis called for the speedy release of the NHI Bill as a step closer towards the realization of quality health care for many vulnerable groups. Unfortunately, a few organizations with very deep pockets continue to fund the narrative that the NHI is a threat to economic growth and jobs. This narrative, unfortunately, takes us backwards and denies the poor and the working class of their fundamental right to quality health care. President Ramaphosa is providing leadership and stewardship on the National Health Insurance implementation process and has reiterated the commitment of the entire South African government to overcome the two-tier health system. COSATU would like to take this opportunity to welcome the Minister's efforts to reorganize the Department of Health to support the implementation of the NHI, as expressed in the Minister's maiden budget vote as Health Minister. The NHI has the potential to massively reorganize the entire system and requires the National Department of Health as the custodian of national health policy to encompass the required capacity to provide policy direction to the provinces. COSATU further welcomes the initiative by the Minister to build capacity of managers to implement the national health insurance by utilizing bilateral agreements with countries that have made a national health insurance sustainable. This move will allow for the building of sustainable local capacity. COSATU further welcomes the establishment of a national health insurance task team at NEDLEC that will be tasked to discuss the National Health Bill. This will allow COSATU and its affiliates to strengthen their calls for the implementation of the national health insurance as initially envisaged at the 2007 ANC Policy Conference and the 54th National Conference of the African National Congress. This process will allow social partners, including labor, business, community, and government, to have a closer look at finer details of the revised bill and receive clarity on the insertion of any new clauses. COSATU cannot emphasize enough the urgency in the implementation of the national health insurance in the face of the quadruple disease burden, as well as the triple challenge of poverty, unemployment, and inequality. As COSATU, we pride and count ourselves amongst the torchbearers in terms of the role that we have played over the years through our policy advocacy and mass-driven campaigns in advancing and defending the national health insurance and the cause of the realization of the right of access to healthcare services to all in line with Section 27 of our Constitution. Thank you.
Thank you very much, Mr. Manamela. COSATU counts itself amongst the torch bearers. SACP, Mr. Solima Paila, or was there somebody else to deliver the statement? Anyone from SACP here? Okay, that's all right. We can move along. Sanex Civil Society, Mr. Mabalani Mfundisi. Thank you.
Thank you, Program Director. Morning, colleagues, Minister, my Deputy Chairperson at Sanex Civil Society Forum, all protocols observed. SANAC Civil Society Forum welcomes the release of the NHI Bill and supports the objectives of the establishment of the NHI Fund. Our submissions to the draft bill in September 2018 have been captured to our satisfaction. We are happy, we are in full support, and we are ready to engage in this journey as in full support, and we are ready to engage in this journey as society will debate this bill to ensure that it reflects the views of what universal health coverage should be in line with Section 27 of the South African Constitution. We would like to welcome the public consultations to be meaningful, but at the same time move with speed so that the national health insurance can be enacted as an act of parliament so that implementation can happen without delay. We do not want the engagement to happen longer than it is necessary, as some processes happen forever. We have called for the NHI, and we make this call now again that we want the NHI now. As civil society, we appeal to this parliamentary process should not be delayed in order to satisfy the private sector lobbyists or any lobbyists whose purpose is to delay, frustrate, or design ways in which to financially benefit from the NHI whilst the health provision does not improve. Parliamentarians serve at the behest of the people, and this parliament should ensure that before its current term ends in 2024, then NHI should long have been passed and enacted as an act. We do not want to see parliamentary capture. As SANAC Civil Society Forum, we have long called for the implementation of universal health coverage in South Africa. When the idea of national health insurance was introduced many years ago, and we may indicate that some of us were also delegates at the 2007 Mangaung conference of the ANC in our other lives, and it's 2019, 12 years, if not longer, Minister. We are ready, very excited that our call for universal health system will be realized. We didn't know that many years later, we would still be talking, advocating, and fighting for NHI instead of seeing it being rolled out. The delay, in our view, was as a result of two stumbling blocks. One, private sector that's hell-bent on maximizing profit by excluding the majority of South Africans, especially poor people, from accessing health services through, and we put in inverted commas, stealing the money meant for the public health system to subsidize private health system by sustaining apartheid-era medical aid tax benefits. This resulted in South Africa currently spending 8.5% of GDP on healthcare, with the private sector receiving about 4.4% of this GDP spend on 16% of the population. Secondly, government kowtowing to the whims of the private sector in the process, failing in its duty to ensure that Section 27 of the Constitution is implemented, which simply enjoins government to provide quality healthcare services to the population. This resulted in South Africa currently spending 8.5% of the GDP of healthcare on the public, receiving 4.1% and covering 84% of the population. However, we are happy, Minister and Deputy Minister, that government is now once more governing in terms of providing the NHI. The NHI is a platform to ensure that the spirit and the letter of the Section 27 of the Constitution and Article 12 of the United Nations Covenant on Economic, Social and Cultural Rights of 1966 are realized, where private sector is happy, whether private sector is happy or not. Transforming the South African society requires that we put people before profits. SANAC Civil Society will continue to confront the highly racialized model of funding for health in South Africa, as we are doing in terms of HIV and TB response. We'll continue the fight against the system of funding that seeks to sustain an apartheid modus operandi that deepens inequalities along racial lines through patterns of development that restricts the lives of Black South Africans. Communities must rise and confront Afro-pessimism agents, particularly those who have strategically placed themselves at the center of health service on behalf of communities, when in fact they are opponents of the values of the Constitution of South Africa and the agenda for sustainable development goals. A universal call to action to end poverty, protect the planet, and ensure that all people enjoy peace and prosperity. As we conclude, the people, especially African poor majority, are most affected by HIV and TB, and they rely solely on the public health system for treatment. The NHI seeks to improve the support the public health system, and this will result in immense benefits for the people. With such an approach, we will see the people through their communities taking place at the front, the center, and the back of their health needs, and by extension, response to end HIV and TB. SANAC Civil Society, we call for the redirection of health financing and accountability through the NHI to address community systems strengthening. And as has been outlined, we are very happy that the move being taken is towards that direction. This goes beyond the challenges confronted by the narrow biomedical centered definition of health as pursuing the absence of disease and infirmity that is offered by the current health system, both public and private, through the administration of drugs, to be replaced by a broader community capacity enhancement based definition of health as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. At the center of this approach, we see the NHI, and we are happy with the steps that are being taken. We are fully behind the ANC-led government, the President, you Minister, Deputy Minister, all progressive MPs. Ultimately, this will be enacted in Parliament, and the civil society formations that are involved in ensuring that we realize the NHI in our lifetime. We will use the power and influence we have to be active agents in this journey. We thank you.
Thank you so much, Mr. Mfundisi. SANAC making a call to put people before profit. I would like to just pause and take a moment to acknowledge the presence of representatives from National Treasury. Without their buy-in, pun intended, we cannot proceed with this bill. So thank you very much to Dr. Blecher for being here. We really, really appreciate it. Dr. Blecher? Oh, he's left? Oh, well. He left before I could make my joke. Okay. I would like to invite South African Medical Association Dr. Angelique Kutsia to come forward, please.
Thank you, Program Director. Dear Honourable Minister of Health, Deputy Minister, the Presidency Delegation, all protocols observed. SAMA welcomes the release of the much-awaited NHI Bill. SAMA acknowledge that as this is the beginning of a new dawn, there will be more questions than answers. It is all good and well to question, but there must come a turning point when one needs to put shoulder to the wheel and start working. Countries like Britain and Japan, to name but two, started implementing their equivalent of NHI under very difficult circumstances, especially financial. And South Africa will be no exception to this rule. The question is not whether NHI will provide better health care, but how the monies will be utilized as to secure funding for better health care. For South African citizens to enjoy quality health care, each of us has an obligation to ensure that we are part of this process. Quality health care with good patient outcomes starts at primary health care level with universal access to services. Communities, local municipalities, regional governmental structures, including Department of Social Development, and the health sector, under the guidance of a centralized Department of Health, need to be involved as partners on this journey. The recent launch of the South African Health Federation, under the leadership of Prof. Morgan Chetty, assists in soliciting partners and finances to improve healthcare by forming public-private partnerships or initiatives which is a first for the South African health industry, and where, for the first time, Department of Health is willing to be part of, willing to join hands, and we applaud you for that. We, as South Africans, simply cannot sit back and expect Department of Health to do all the work and then blaming them for not getting it right. The Honourable President of South Africa already demonstrated his commitment with the signing of the Presidential Health Compact about 2 weeks ago. Department of Health is clear on their mandate that the upgrading, the waste, the abuse, fraud, bribery, the human capital of the public sector is their priority. Universal access will not be possible to our citizens if this is not sorted. Our current public sector needs this total makeover to ensure success. But we should not be fooled for one moment as to think that the private sector, especially the monthly medical schemes contributions, with a decrease in subsequent benefits, will be financially sustainable in future. It will not. We need an urgent reform in our health care as to ensure access to quality care where the patient-orientated health outcomes must be a priority. My plea to fellow colleagues and citizens is to let us all work together as to ensure a better healthcare future for our children and the rest to come. Sama, thank you, Minister, and our previous Minister of Health, for not having given up on a difficult and much criticised bill, of which Sama supports fully. In conclusion, to quote Mother Teresa, let us touch the dying, the poor, the lonely and the unwanted, according to the graces we have received, and let us not be ashamed or slow to do humble work. For not all of us can do great things, but we can do small things with great love. On behalf of SAMA, the Unity Forum of Family Practitioners, I thank you all.
Thank you very, very much. I would love to reiterate that quality health care with good patient...
All right, has this press briefing cleared up all the questions that you have on the national health insurance? If it hasn't, let me try to help. Let me try to break this down, albeit a bit reductive. But it's basically a system, a financing system, health financing system that is designed to pool funds to provide access to quality, affordable personal health services for all South Africans. Now, this is based on their health needs, irrespective, we're told, of their socio-economic status. Now, this means basically that every South African will have a right to access comprehensive healthcare services free of charge at the point of use at accredited health facilities such as clinics, hospitals, and private health practitioners. Now, the services will be delivered, we're told, the closest to where people live or work. And we're also told, as we heard now from this press briefing, that NHI will be implemented in phases over a 7-year period. Lots to discuss on this. I'm sure there's much more questions that you have than answers in terms of NHI, but we will try to help you in terms of trying to break this down to you and give you what are some of the benefits that will be there for you as a user of NHI, and some of the drawbacks that's also part and parcel of NHI. All right, we're monitoring a number of stories this